Everybody, kind of welcome. We are VSC Integrative Medicine. We've introduced a new service called EBOO. This to my right hand over here is Julia. She's our RN. We brought her over from Mayo. She was doing chemotherapy, radiation therapy. She was also doing that with children beforehand at PCH. She's our highly qualified person that I had to recruit and beg over and over again to get her in here. And
it was the other way around, but we won't go there.
No, not at all. And basically, I wanted to start getting into the regenerative medicine space, and we introduced EBOO. So Julia, can you kind of explain what is EBOO?
Yeah, of course. So EBOO stands for extracorporeal blood oxygenation and ozonation. Basically, it's this big fancy term for you've got two IVs in you. One is pulling out your blood. It's going through our whole machine and apparatus. It's got a filtration system in there, and it's a dialyzer chamber. That dialyzer chamber helps to separate those red blood cells. In there, it also holds on to any of the bad stuff in your blood. So any of those pathogens, heavy metals, plaque, all of that, it holds on to it. While also, ozone is continuously being infused into that chamber. So every single red blood cell is getting infused with ozone. So that separation helps to really open up the red blood cell, give you the greatest surface area to put ozone back into it. After that, it goes back into your body through that other IV, and you feel amazing. Ozone has so many benefits, it's crazy. And I think that's why, we really wanted to take on this adventure here.
Yeah, 100%. And so a lot of people have misconceptions about ozone. Can you kind of explain how this machine differences from inhaled versus colonic and anything like that?
So this is strictly oxygen converting to ozone, and it's on a blood level. It's not anything that you're going to inhale. It's not being injected into you directly. It's a very safe gamma amount of the ozone going into you. There's been tons of studies on how long it should go for, how many lights or gamma we should do of the ozone, and all of that basically creates a very safe environment. And it's a closed connection system, so it's all on that blood cellular level, so it's not anything that's going to go into your lungs. Really all it does is it just helps to super oxygenate your red blood cells, and then when it goes into your body, it actually, the second it goes into your body, it kind of converts back to that O2, but it's supercharged, and so it's going to go throughout your body and give you all those great benefits.
It's a very good, complete oil change for your blood system. About how much blood can it circulate at one time?
So it depends on the patient. Some patients have a little bit more debris than others, which can sometimes affect the pool, and so we might not get as much blood. But in a 60-minute session, the minimum amount of blood going through is 1.8 liters. The maximum amount is 3 liters. A person has anywhere from 3 to 6 liters of blood in their body. So depending on size and stature and everything, it could go through over half your blood supply in just one 60-minute session.
That's phenomenal. So it's another reason why we want to implement this is because we're kind of, as chiropractors, we kind of heal your body, from inside out as far as adjustments, right? We allow your body to heal itself. Essentially, this machine we kind of brought on, it also is allowing your body to heal from inside out.
Yeah.
We're pulling, she talked about getting filtered, filtering your blood. What is actually being filtered out?
So there's a few different things that are being filtered out. Biofilm, endotoxins, those are all big words for just kind of basically the bad stuff in your blood. Biofilm can be plaque buildup from like cholesterol or fatty foods. The endotoxins could be, say you have had a viral infection, or you have a chronic disease or an autoimmune condition. All of those produce these endotoxins. And so it takes out all of the viruses, bacteria, fungus, anything like that, parasites, it all kind of helps to take those out, filter those out. And the great thing is that ozone is a natural detoxifier. So even if it's in that filter, it doesn't get held onto. When the ozone hits it, it immediately kills it off because it's an anti-parasitic, antiviral, antibacterial, antifungal. That's what I love about this, is that it will just kind of immediately kill all of that off.
And you know, guys, we've had some patients in here with certain types of conditions, whether it be, if in Arizona we get valley fever, and it's usually from the dust storms. We get the EBOOs, which I'm sure you guys have seen all over YouTube or Instagram. Now with that, it's kind of developed people to kind of getting some heavy mold in their body. Can you kind of explain what that debris kind of looks like, and the debris is actually mold coming out through the bloodstream?
Yeah, so it's very interesting to see the debris coming out, and different conditions kind of have different characteristics in their debris, which has really been quite interesting to see. Our mold toxicity patients, their debris, and our valley fever as well, their debris, and in the pool line, it almost looks like bubbles. It looks like very kind of small bubbles throughout the line, and that just shows all the debris that we're pulling out. Whereas our Lyme patients, Epstein-Barr patients, those have a little bit smaller clusters. They almost look like a really small grape cluster, and they're a little bit more kind of frothy in nature. On our Instagram page, EBOO_for_you, I've got lots of pictures of what the debris looks like, the before and after and everything. So if you want to go and check those out, just kind of understand exactly what we're talking about, you can see those there. But it has been so interesting to see the different characteristics of debris from disease to disease.
No, it's remarkable. I've observed a lot of the cases that come in. I try to meet every patient that comes in and introduce myself. With these treatments, how many should you get, and kind of how often?
So that is something that is not an easy question to answer, because every patient is different. Science shows, and the research behind it shows, the optimal amount of EBOO treatments is 3 to 4. That is just because that enables us to go through your blood system about 2 times. If you're a bigger person, you know, we're gonna get through your blood supply twice. If you're a smaller person, it's more than twice. So that's the ideal amount of treatments. Now, the length in between just differs. What I really like to do here at our practice is I like to see the patient first, see how their first session goes, see how much debris we get out, how they feel a couple days after, you know, what they're feeling, if they're feeling better, if they're still kind of feeling a little bit under the weather, all of that, and then tailor it from there. Ideally, I would like to see them once a week for 4 to 6 weeks, depending on their diagnosis. But then there's other patients that come in just for kind of wellness visits. It's like we talked about, it's like an oil change. And those patients can come in every 4 to 6 months. You know, it differs patient to patient. Like I said, those chronic illness patients and those autoimmune patients, I would ideally like to see once a week for 4 to 6 weeks. Whereas other ones, I kind of say, you know, if you feel good and you're doing okay, let me know when you start feeling a little bit worse, and come back and we'll give you another treatment.
That's awesome. Yeah, so what we like to do is, not only are we treating these people once a week for about a 4 to 6 week period, but you know, Miss Julia likes to concoct some good IVs that we go along. So not only is your body getting rid of the bad, we like to infuse it with the good. So we offer things such as NAD, phosphatidylcholine, glutamine, glutathione, kind of go through the whole gambit of IVs. We use that as a chelation, right? Can you want to explain how we do that and how we're kind of amplifying this EBOO process?
Yeah, so like NAD and the phosphatidylcholine are amazing drugs. I would ideally, for every patient we see, like to about 3 days before their EBOO procedure, bring them in for an IV and kind of talk to them about what they're getting the EBOO for, and then tailor the IV from there. High dose vitamin C is a great IV that I use to just really kind of help ramp up that immune system. It kind of gets everything rolling.
Right.
So then once we do the EBOO, we can really pull out as much of that disease as possible. The NAD and the phosphatidylcholine are great for more cellular levels. That phosphatidylcholine, or PC is what we call it, is really, really great for our mold patients, and also for any sort of hepatitis or liver function patients, because it helps to pull that mold out from its kind of hiding places, and then it really helps the liver to detoxify all that and clean it out. But then, like I said, we get them in here for EBOO, and we get to just pull that out and really kind of detoxify it on a whole new level. So that's what I ideally like to do. I really like to talk to my patients, get a full history, and go through, what all are you experiencing. And the thing that I truly love about EBOO the most is I'll be sitting in here doing an EBOO session with them, and say they came in for Epstein-Barr. But then I'm talking to them, and they're like, well, I've got high cholesterol, and we've got history of cardiac problems in my family, and I don't think I've got great circulation, and they'll just kind of be telling me some of these things. And the awesome thing about EBOO is that it's going to help with all of those. Coming from the medical field, it seems like we always have to do an individualized thing for each problem. Okay, for your cholesterol you need to do this, and for this you need to see this provider and everything. And that's what I love about this, is it's kind of a one-stop shop. It helps to really go through all of those things and help with all of those things, instead of me having to be like, okay, well, I've just fixed one, but you need to go see 4 other providers for these other things.
Right. Kind of an all-inclusive thing.
Yes, definitely so.
Something we do more of our chronic patients to do is either get blood work beforehand, or what we'll do is we'll consult with them, and you meet with Julia, and we kind of go over your case history, right? We can kind of find out what blood work needs to be ordered, so we don't waste your time with that. It's part of the all-inclusive. We do that here at VSC, so that's not an issue at all. And then what we do is we do the treatment based upon those things, and the chelation based upon all those issues, and other kind of problems you've been experiencing in the past. And then a great thing to do is we can kind of do post labs, so that you can kind of see it with your own eyes, that your physiology is changing and it's getting better, and that's something that is remarkable with this. Are there certain types of people that can benefit, or who can really benefit from EBOO? I know you kind of mentioned just the general wellness type people, and then as far as the benefits, what are patients really experiencing? What are they saying, the ones that have come in?
I've seen a lot of really positive cases. I've had a valley fever patient who was really, really sick. He'd been sick for about 6 months, wasn't able to work, wasn't really able to do anything. He was just so fatigued and worn down. And after one treatment, he was able to go back to work. He was able to start doing all the things he enjoyed again, getting out there. I have had Hashimoto's patients that their first treatment is very, very full of debris and everything. Their second treatment it's like it's a different patient. It's been really interesting to see, and they felt a lot of those effects after the first one, but then they felt even better after the second one. I've seen a range of things. A lot of autoimmune patients can benefit from this, because ozone is a regulator of your immune system. So it's going to go in there, and for autoimmune patients, their immune system is overactive, so it's just going and going and going. The ozone therapy going into their body is going to tell their immune system, hey, let's calm down, let's go back to an optimal level, let's not go at this fast pace like we need to. Whereas, with chronic disease patients, hepatitis, cancer patients, ones like that, their immune system is underactive. So this is going to go in there and be like, hey guys, let's pick it up. We need to get going again. So I've seen a variety of patients and a variety of results, but all of them have truly been really positive. Everybody feels it a little bit differently. I think the one that is the hardest is the general wellness patients. Because they feel like, the next day they're going to wake up and feel like Superman. And they might feel a little bit better, but they don't notice that drastic change. And a lot of that I have to, really educate them on is it's at a cellular level that this is happening. And for people like us that feel good every day, it's hard to notice that change of like feeling a little bit better. Whereas people that have these chronic conditions and don't feel good day to day, they feel so much better in the days post EBOO because they are not used to feeling that way. But I just always have to remind everybody it's happening on a cellular level. So you might not feel like physical, growth from it, but it is helping in there. And that's the thing to just always encourage people of.
Right. So we've treated some pretty elite athletes coming in here, and they're so in tune with their body. They're able to feel the benefits immediately, whether it be from increased recovery time, which is huge with these guys and these girls that are performing at such an elite level. I know me personally, I experienced fantastic sleep. My sleep and my rest, and for those of you know, if you can rest and you heal your body, you can fight off disease easier. And for me, it kind of essentially reset my body's own homeostasis, kind of changed the physiology of that, and allowed me to not only when I wake up, I was waking up a little bit earlier, and that's without the alarm clock. I didn't notice that, and that was awesome because there's no lethargy in the morning.
And that's what I encourage people to look at is look at your recovery level from working out. Look at how you're sleeping, how you're waking up. How's your fatigue and your brain fog doing? How are you functioning? Are you as sore after working out? Are you recovering a little bit better? Those are just the little changes that can occur that you can kind of physically pinpoint. And I know I was kind of the same way after my treatment. I felt like I was sleeping better. My brain fog was so much better. I had a lot more clarity. I just felt like everything was being absorbed better. I was moving at a better pace than I was beforehand, and everything was just working together.
No, you heard it. She's seen more cases than I have. Something that's pretty remarkable, but people ask, why is EBOO here? Why is it so new? It's actually not very new. There's a board of ozone therapy. It's been going around over 100 years. In other countries besides the US, this is the standard of care. This is the standard of care to treat cancers, to treat every chronic illness, cardiovascular diseases, super high. Every journal article I've looked at, cardiovascular disease is key because cardiovascular disease, you have plaque, right, and it gets removed. So off the bat, people think, I'm prone to stroke, or I have this issue with my heart. That's the number one reason you want to kind of get into this. I know lately it's been the COVID theme. I know her and I, we got to have a chance to work with the person, Angie, that trained us, and just kind of see people's COVID cases within the treatment. The patient was getting better within 15 minutes. And you could see the color of their face, the breathing decrease as far as the effort amount that it took for them to breathe, right? Their O2 sats were going, and that was within 15 minutes of the care. And so that's kind of what blew me away is when I kind of ran across this whole procedure of what is EBOO. It is rare. It's rare in the United States. What is there, less than 20 machines in the United States?
There is 13 machines in the United States, 10 clinics that have this machine, and we are fortunate enough to be one of them.
Right. So this is a very rare opportunity, as hopefully it does get more mainstream. And like I said, more of a reactionary care. It's kind of what the medical standard has been, very reactionary, and we want to be more of a proactive type care. Get these people ahead of the game, give their body a fighting chance, kind of change your physiology a little bit different. Kind of what's the price of the treatment?
So it is not a inexpensive treatment, unfortunately. The price per treatment is $1,500. That includes a 60-minute session of EBOO, and then at the end we do a complimentary vitamin B complex and B12 IV, because you've already got that IV in there. That just really helps to kind of boost your system and boost your fatigue and energy levels and everything. So it helps with that. But we want to help people here. We want to work with people. And I know we're not offering any sort of packages right now because we don't want anybody to feel like they have to come back a set number of times. Correct. And they are, locked into that. But we like to work with our patients as much as we can for those people that do come back for multiple treatments and everything.
Correct. Yeah, we know that the price can be heavy, and it's not covered in insurance, and if it is, a very little amount is covered. Some people say you can bill it. That's kind of up in the air right now. We're always looking for more ways to evolve it.
Yeah.
But one thing that we do is here, we're very to our word.
Yes.
What we like to do is if you come in, and I had a consultation over the phone with a patient a couple days ago, I said, listen, I'm not going to give you a protocol that's cookie cutter protocol. Listen, if you can't afford a certain amount of things, then let's maximize your dollar to benefit you the most. And if I have to throw in some different nutrients and IVs, if I could have Julia kind of we'll kind of write something off to make the experience better, we are willing to do so.
Yeah.
By all means, we're not giving away free treatment, but what we are going to do is make sure that you're treated fairly, just like I would like to be treated any other clinic I go to. Is there anything else you kind of like to add about the experience and what to expect here? Or?
If you have any questions or kind of just are a little apprehensive about it, I do free consultations, so I'm happy to talk with you over the phone, have you come into the office, show you kind of the machine, how it works, everything like that. I'm more than happy to do that. But coming from I've been a nurse for 5 years now, and that was all in a hospital environment and very medication driven and pharmaceutical driven, and then just coming to this side of things has been so encouraging and just so inspiring, because I'm able to help people without throwing the kitchen sink at them, throwing all these medications that have tons of side effects at them. That's the thing that I love about EBOO, is there's really no side effects. You might feel a little bit weak and tired a couple days afterwards, but that's just your body healing. It's it getting used to, we had so much junk in here and now it's not in here. We don't know how to operate with this much oxygen and this much flow in our body.
Right.
So that's really the biggest side effect, and that's what I love about this, is there's really no downside. It can help a variety of people, and it is just so incredible to see the results, and it's just been very inspiring for me in a dark time in healthcare. It's been nice to just have this inspiration and feel like I truly am helping everyone, and I want to be able to help everybody. At Valley Spinal Care, our kind of slogan is "We can help," and I really feel like through this EBOO process, we're doing that and able to see a variety of people, and we try to get them on all sides, the chiropractic side and here, IVs, all of that. It's really great how much we can offer here. So I highly encourage you to come in, see us, give us a call. Our number is 602-788-4200, and ask for Julia. I am the one that you will talk to about all things EBOO. So
thank you, Julia. Appreciate it.
Yeah.
Dr. Mike and Miss Julia, you guys have a great day.
Thank you.